Hi, I'm Jeff Walter, and welcome back to the podcast. I have a special guest today. His name's Bill Ryan. Bill is the Director of Technical and Clinical Education at Ziemer Ophthalmic Systems, which is a Swiss company that manufactures femtosecond lasers that are used in a variety of applications on the eye, including cataract surgery, flap creation for LASIK treatments, as well as other therapeutic applications such as partial and full corneal transplants and refractive treatment based on uncontil extraction. Ziemer also manufactures a refractive laser system that's used to perform LASIK ablation, as well as diagnostic devices that precisely measure the three-dimensional shape of the eye. Bill has been working for the company since 2011 and became involved in e-learning content development and management of the e-learning site since 2017. Welcome to the podcast, Bill.
Thanks. It's a pleasure to be here, and thank you for the invitation.
Yeah, so I'm always interested in how people ended up where they're at. So maybe you could tell us a little bit about your background, how you ended up running the training program for Ziemer, and a little bit more about Ziemer. So this is very interesting training program because it's all surrounding around medical devices and training people on the use of the medical device. But give us a little bit your background. How'd you end up where you're at? You've been on the learning side since 2017. Was Ziemer since 2011. So how'd you end up running the training program for Ziemer?
Yeah, well, in my background, after I finished my studies in electronics engineering, I luckily got into the business of medical lasers, and I've been in this business since 1987. It's been a long time since I've been
Oh,
in this
wow.
business. And at the time, it was very new technology. Now you see lasers everywhere, in your computer, in your entertainment center at home, everywhere you can find a laser somehow. But back in the day, they were very, very rare, particularly in the medical business. So most of the companies that I worked for were basically startup companies. And I learned in this environment that everyone's kind of learning together. And how do you communicate the best practices and service procedures and applications usage? How do you communicate this to people? And in the past, we had classroom courses, of course, and on-site training with the doctors and clinical staff. During this time, I got involved in document development, writing service manuals and technical procedures. Yeah, so that's my background in this kind of education aspect of it. In 1995, I entered the world of refractive surgery with LASIK with a company here in Florida called LaserSight. And, they didn't have an education system at the time. They didn't have any real technical documentation. So luckily, it was a startup company, and they allowed me the opportunity to contribute as much as I wanted to.
Right.
And then in this role, I developed the service manual and the training curriculum for this. So this really started the ball rolling in terms of my going down the path of education.
So what gravitated? I mean, a couple of things. One is I think that's one of the underappreciated things of small companies and startups, and working for them is you can really have an opportunity to take on as much responsibility in whatever areas you want because there's so much to do and so few people to do it.
Yeah.
But what was the thing pulling you into the education and learning space?
Well, there was a need. There was a need that had to be filled,
Uh-huh.
and it's just kind of my personality type that, when I understand how to do something or understand how something works, I kind of like to share that knowledge with other people. That's just my personality type.
And then learning and development makes perfect sense. Okay, so you're at the startup. That's where you got into the learning and development side of things. Going from the documentation over to more of a training, and then where do we go from there?
Yeah. So my career led me to different companies, and I was in all of these companies. I was contributing in the same kind of way, documentation for most of the time service procedures, and eventually I found my way to Ziemer. And I started out actually as a service and application engineer, taking responsibility for Latin America market for installation, repairs, maintenance, and training of the devices.
Okay.
During this time, Ziemer developed a new line of lasers that they really didn't have anybody who was interested in writing the service manuals, basically. And they learned that I had some experience, and I wasn't hired to do that job. I was hired as a different role.
Right.
But they learned that I had some experience in doing this, and was interested in taking the responsibility with the company. And fortunately, they gave me the opportunity not only to take the role, but I actually lived in Switzerland for 4 or 5 years, taking care of it in Switzerland.
So that's how you got into learning and development within Ziemer.
Exactly. My foot in the door was technical document writing.
So let's talk a little bit more about the program. So what are you and the company trying to accomplish with the training program that you're managing? What's the goal? Why are we who are we training? What are we hoping they can do? What do you hope to accomplish?
Yeah, so with the training program, we have a responsibility not only to train our internal staff. At the moment, we have, I think, 20 something direct employees working for the service department. And when I say service department, this means maintenance and installation and repair of the devices, upgrades when necessary, but also training the doctors and clinical staff the usage of the devices.
So it's the technicians that are the service technicians that are doing the install, maintenance, and repair, and the providers, the doctors, et cetera, that are actually using the equipment.
And the end user training, the doctors and clinic staff. But in addition to that, we have a lot of distributors that we're working with.
Okay.
And in fact, the distributors are taking the main role in servicing and training the end users. So, with my job, I have actually a couple of different audiences. If we're talking specifically about maintenance, technical issues, let's say, and applications issues, which are the usage of the device. So I have the direct employees that we have to worry about training, and have to worry about the distributors as well. And quite important in this line of business is regulatory requirements. It happened. Fortunately, I came across LatitudeLearning in about 2016. I think we started our relationship around then. Mm-hmm. But around this time, there was a regulatory requirement that came up in Europe due to an adverse event. I don't remember exactly what the event was, but there was a lot of regulatory changes that came about. And one of the changes was we have to know who was trained, when they were trained, who did the training, and how are we quantifying the effectiveness of the training.
Right. Okay.
Not only with Ziemer, but every other company that I worked with, somebody comes to the classroom training, they put themselves in a chair and they stay there for the duration of the course. There's a test at the end, and you are now certified. Okay, but that's not good enough anymore. Okay, and so the requirement is who did the training on what, and also is the procedures that you have been trained, are they still valid? Okay, so it could be that they were trained on a version of software that's no longer valid anymore in the field. So we can't say this person is certified anymore because that software will not be on their systems. The e-learning site, as I said, we started our relationship in 2016 when this changes in Europe came about. And that gave me the opportunity to really configure the e-learning site as a tool that we can use to monitor all these things, who's been trained when, who did the training, and also put a certification structure into place where when we have product updates in the field, through the site, I can actually, in the back end programming, I can change the certification requirement so that a person who was certified before, now we have a different procedure, and they will automatically lose their certification until they take the associated course, and then their certification is back in place again. So this really helps the quality department and service management keep track on who's doing the right thing in the field.
So it's a dynamic certification. is,
Yeah.
like you're do everything that I need to do to get certified in this particular product. But then as the product evolves, I can lose my certification because I'm certified on something that's 5 years old and we've completely changed the same product name, but completely upgraded things. And that was a different way of doing things. Interesting. Hey, you said something earlier about the regulations about the effectiveness of the training. So how do you guys measure that? Like from a regulatory standpoint, that's the first time I heard from a regulatory standpoint measuring effectiveness. Usually most regulations that are tied to training are focused on more that first part that you said, butts in the seat, that, so and so attended the training or took the online course and is, and they got their check. And so boom, regulatory wise, you're okay. But you said that that there was some effectiveness requirements. So what's the regulation there? Like, what are they asking for from an effectiveness
Well,
standpoint?
excuse me. Well, in fact, it perhaps misspoke in that are the people certified?
Okay.
And so that is the effectiveness measurement: is are they certified to work on the equipment?
Okay.
And in the course structures that I developed, there are um, a couple of different ways that people take the associated courses. Um, and I'll take the technical basic course as an example. It has something like 21 individual procedures that have to be trained. And of these 21 procedures, most of them are e-learning in an e-learning format. I use Storyline as the content development tool. So we'll have tests in the end, sometimes interactive tests to see if people know, if the course was effective enough that they can pass the test. Let's say, yeah,
Right. Right.
yeah,
Yeah.
and then
That
we
they've
have self-study.
acquired the necessary knowledge.
Yeah, and then we have self-study courses for things that are less critical in the field as well.
So, but then I'm just curious on the regulation side, because was the regulation the thing that drove the dynamic certification, or were you thinking of dynamic certification regardless of the regulation?
Well, the chronology of this was essentially while these changes were coming about
Yeah.
was when I started with LatitudeLearning, and so then I had it already in the back of my mind.
Okay.
This has to happen. How can I make it happen? And fortunately, the Latitude platform supports that.
Okay. So the dynamic certification was something that you were like, okay, it's something you wanted to do, but then it also ties into it helps on the regulatory side in that if somebody's certified, they're certified on the latest and greatest version of the certification versus, I got it 10 years ago and, I haven't focused on anything.
And it's
Okay.
also quite helpful from the quality management. I would say Ziemer is quite thorough in their audits. So when somebody and we don't do audits on we have a lot of distributors and we have a lot of internal persons as well. So, many times in the audit process for the distributors, they are audited on a biannual basis. So every 2 years, they look at how they're operating. The internal people, I believe, are on an annual basis. But what will happen is quality manager will take a random service case and say, okay, this person did this service job. Were they trained to do this service job? And at the time they did this service job, were they trained on the correct procedures for that time?
Right. At that
Because,
moment. Yeah.
yeah, exactly.
So, do you guys have any requirements on the distributors in terms of like the certification down at the individual level? But is there a certified distributor, or a distributor has to have a certain number of certified people, or like if you take the example you just threw out there, it's like, okay, let's just assume the person was not certified. It doesn't mean that they did it wrong. It just means that they hadn't completed the training. Why would a distributor spend the time and energy to have their people certified? Is there a requirement there? Is it, half the people? What's the how do you guys in the distributor's best interest to get their people certified?
Well, it's actually a requirement from a corporate standpoint that the people who are working with the systems need to be certified.
Okay, so part of the business relationship between the distributor and the Ziemer is that the people doing the service work will be certified.
That's correct. Yeah.
And therefore, when they do that, you had mentioned an audit earlier. If they find that they were not certified, the question would be why. And, it might be some perfectly reasonable explanation like, you guys just updated the certification. I, as the service technician, was certified yesterday, lost my certification today, went out and did a job. And then tomorrow I took the course and got recertified, right? And you would look at that and go, okay, that was an exception. But the expectation is that everybody is certified.
Yeah, that's true.
Okay.
And it happens quite often that way. And also, as a company, we have to be really sensitive to the fact that our distributors, they don't sell only our product, they sell lots of other products. So when they go out into the field, they have other things that they have to do. And so we have to be, conscious about this and understanding, of course, but also we have to be a little bit firm sometimes and say, look, okay, please keep up to date with your certifications. Else, we will have a situation with the audit.
Right. Yeah, that makes sense. And so getting back to who's getting trained, you've got the internal your internal service folks, and then you have your distributor service folks. Is there any sales training, or is it all on the service side?
It is. There are other training audiences that participate from time to time. Sales managers, product managers for our distributors, and also internal attend the trainings, the classroom trainings, and we make the e-learning available to them online. However, the e-learnings for sales people and product management and others, they're not a requirement.
Okay.
So I had to set it up in the background, in the back end, that certain persons with a particular profile, they are
Right.
expected to keep their certifications. Others who are not in this profile, we don't care about the certifications. We encourage them to take the course, but we don't require them to take the course.
Okay. So on the sales side, there's I'm just trying to set it's more of a self-directed program. You've got the training there, it's available, you encourage people to do it, but you're not assigning the training to them, you're not requiring it of your distributors. But on the service side, which completely makes, I totally understand on the service side, because this is a medical device that can do great damage if it's not working properly.
Yeah, and also from the application side. So we have two basic groups that we're training. We have this technical service that we're training and application support. And in Ziemer Corporate in Switzerland, and also we have an affiliate in Germany, they blended those two roles together so that we can have the same person who is doing service support and application support. The US affiliate has split it, so we have technical only and applications only. So the applications persons are also expected to maintain their certification. But the certification requirements are not as rigid because we don't have so many changes to the certifications when they first came to the training,
Right. Okay. And then you had mentioned earlier another audience, and that was the medical staff, the doctors and nurses, and the actual providers that are doing it. How does that work? What's the nature of the training there? How does that program look like?
Yeah, so with the end user training, this is something that's more recent with the e-learning site. We had some new applications introduced in the last couple of years, and we've made some significant changes to some of the applications we've done in terms of the device settings and so on. So the idea from my side was always to encourage the end users to take certain courses so they're familiar with the technology and they're familiar with the application that's going to be trained. And the idea for all this is that, for us to do the training on site personally, that's a 2-day job. If I can take some of this time And if the user can take some of these courses, that should potentially shorten the on-site time.
Okay.
And so that's the third audience. It's now kind of it's getting a slower start than I would like.
Okay.
But there's also some challenges that we have from the acceptance or what's the word I'm looking for?
Like participation rates or?
Yeah, or because it's a little bit not how we'd worked in the past,
Oh, okay. So
adoption, let's say. Yeah.
adoption of the change.
Yeah. So,
Yeah.
I mean, I put in a lot of time in collaboration with my work colleagues in developing some multi-language courses, and we want to push these out to the different markets so that the doctors can have a look at them before we show up. In certain markets, it's working. There is a requirement that before we come for training, please do all of this. And there's somebody following up. In other markets, it's like the doctors are not interested. They don't have the time. The staff cannot do it during their working hours, and they're not going to do it on their private time. So it's a different dynamic.
But that's interesting because it points to different cultural norms. Usually when we think of culture, we think of more pop culture with it, but there's also cultural norms within professions. It depends on the type of work arrangement, and you guys are Ziemer's a global company, right? You're selling in all the major continents, and so you're running into different modalities or different types of healthcare systems with different provider relationships,
different attitudes.
And different attitudes. Yeah. It's interesting that because I mean, we've experienced, or in our clients, that blended learning of take the e-learning first. You can get, not only does it cut the amount of time down in the classroom, but also the classroom experience is a much richer learning experience for the learner, because usually in a classroom you end up teaching to the lowest common denominator, right?
Yeah.
And so it's interesting that it's interesting. It just reminds me that it's a big world and there's a lot of different people out there with a lot of different viewpoints of how to do things. So that's pretty interesting.
Yeah.
That's so and on that side, it's all how to use. Another question I had: you used the word applications several times, and I'm a software guy because we run a software company here. So I always think of software applications. But was that what you were referring to, or was it application of the device to a certain procedure?
It's a little bit of both, because when we're doing a LASIK procedure, for example, we have a software specific for that for that surgery type. Yeah.
Okay.
So we have to we use the hardware in a different way by software control. So in this aspect, we have the LASIK software, but then we have to teach the doctor and the clinic staff how to navigate the software and also what they have to do with the patient.
Okay. So so when you're using applications, it's more device application, and then along with that comes some application specific software applications. Does that sound about right?
Yeah.
I get that right? Okay. Interesting. So now those are kind of, and again, back to what you're trying to accomplish here. I guess it's, you want to make sure that the technicians know what they're doing in installing, servicing. And so you're doing that, and that the medical providers know how to use the equipment properly, right? So that you get the medical outcomes that you're hoping for.
That's correct. Yeah.
Okay. So what have you found as some of the challenges of, I mean, we've touched on some of that, but just in general, challenges, we talked on some of the challenges in terms of, getting people to certain classes or courses, but just in general, what are some of the challenges running this type of program, and especially on a global scale? You touched on some of them, some cultural differences or ways in which, doctors in one part of the world behave differently than doctors in another part of the world. But what are some of the challenges you guys have been facing, or you've been facing, trying to roll this out?
Yeah, I would say initially the challenges were getting the back end of the e-learning site configured to the point where I could just basically let it run by itself.
Okay.
So there's not a lot of I shouldn't say that there are interactions that I have to make from time to time, but
Right.
The certification management is pretty well handled in the site. The challenges are actually more from a usage standpoint. So discuss now the challenges of trying to get our end users to log on and take these materials. And we have to put in an internal process to try to enforce that a little bit better.
Okay.
So now this is nothing to do with the site, but it's more to do with how do we manage it as a company. And in addition, I became involved with this to handle the need for making sure that our internal staff and our partners are trained and they're certified. And so that's was the original intention. However, in the back of my mind, as I said before, always was trying to get the end users involved so we can shorten the training time. That said, if you look around any company, Ziemer is no exception, there's training needs everywhere. Everywhere you look, there's the need for training. So we have, the HR needs to train their people on certain things. The quality department has training. Production has training. Clinical medical affairs has training. There's everywhere people are doing trainings. And a little bit challenging is that, how do we track who's been trained? And unfortunately, with not only this company, but every other company that I worked with, every department has their own training plan and they track it in a different way. And if you ask who has been trained on this individual thing, then somebody's looking for an Excel sheet someplace they can print it out and show it, And we have the tools that we need. We can put all of this together in one training program. And so the challenge that I have is trying to get the interested parties to latch onto this idea that, I'm here for you too. It's not only the distributors and technical people. I can help out every department.
Interesting. It sounds like that. It's always a challenge when departmentally when that I own this turf, but there's a better way of doing things, but the better way of doing things requires me ceding some of my authority, as it were.
Well, there's this, and there's also, I've been working in this department since forever, and we've always done it like this. So
right.
Why should we change it when it's working for me? And it also might be something like, we've always done it this way. Why have you always done it this way? There might be a good reason. We've always done it this way, or there might be no reason. I just inherited it, and this is the way we did it all the time.
Yeah, it was interesting. I was just talking to a client, and it's there's a lot of if it ain't broke, don't fix it. Because you can't focus on everything all the time. So things that are working, you just kind of let sit. Is kind of the default.
Yeah, the Swiss say never touch a working system.
Right. Yeah. And I was just talking with a client. We were going through some processes, and the interesting thing was, and that's fine. And then time goes by, and what you can do changes, right? Because the technology and the tools available to you change. And we were going through a couple of, and these weren't major processes, but we were going through a couple of processes. It was like, we did that because 10 years ago, that was the only way you could do it. And now, there's so much cloud computing out there. We should put that on the cloud. And so there's just a bunch of things like that. It's like, hey, why are you doing this way? And it turns out, well, that was the best way to do it 10 years ago, but life has changed. And now there's actually a better way to do it that can save money. And it wasn't necessarily, we weren't necessarily focused on learning in particular. It was more of a technical, technology thing. But it was really interesting. It was really interesting for me. It's like, it's if it's not what you just said, if the system isn't broken, don't fix it. But then if enough time passes and you go look at it and you challenge, you kind of challenge the initial assumptions, you'll find, well, that was the best solution at the time. And now we can do it, better and cheaper.
Yeah.
Right. And it's just interesting because it's going off topic a little, but it's one of those interesting dynamics is, well, you can't focus on everything all the time because there's everything encompasses a lot. Right. But so if it isn't broken, you kind of ignore it, but then you kind of really want to, occasionally circle back around or periodically circle back around because your base assumptions might have changed.
Yeah, and I can actually give you a perfect example that jumps into mind as you were talking.
Yeah.
Is that when I during my career in document development and technical documentation, everything's it's on a piece of paper, right? And Ziemer is no exception. Our quality management system is based on paper. So if we have an audit, somebody wants to look at the piece of paper that was valid at the time, you know, and nobody's working with paper in the field anymore.
Right.
And if I look at some of the procedures that I have to write, we have a lot of heavy software interaction in our service procedures. So if I think the worst example will be a particular procedure where they have to go through a number of different software screens. And me writing the procedure, I'm forced to like quantify what people have to do. And I was like, there's 25 clicks that they must do on this in the software to do this. If I print this on a piece of paper, it's a 50-page document, and who are we making the printed documents for? It's for the auditors. It's not for the people in the field. So I sort of got around this by it's possible these days to in a Word document you can import a GIF or a GIF. I don't know how you pronounce it. So I can make a small video and show the software interactions in one screen, in one area of the screen. So they just have to watch this video, and it keeps the size of the document shorter. But exactly what you said before, technology has moved along, and we have better tools to use now.
That's interesting. So you still have the paper because you can print off that document, but you've embedded a video into the document, and therefore the consumer of the document can be much shorter, and they watch the video to get the click here, click here, click here to do what you need to do.
Yeah, I mean
That's pretty cool.
Nobody's printing the documents in the field, and you can carry around well, we don't have encyclopedias anymore, but
Yeah.
nobody's carrying all that paper around, and everyone's using their computer or iPad anyway.
Yeah, yeah. Well, it's funny on a completely separate note. Every time I go into our supply room, there's the old binders, the old binding machine. We used to,
Free ring binders.
Well, no, for like a presentation or something, the little plastic binders, and you would open it up, and you would, you put it would punch like the dozen holes in the presentation, and then the plastic binder would, the thing, you opened it up, and it closed it. And every time, I mean, it's sitting, that and all the supplies are sitting in our supply room. And every time I go in there to grab something, I look at that and I'm like, we really need to throw that out. We haven't used it in over a decade. Because, to your point on the paper and all that, it's like, well, that's what you used to do, right? You used to print off the presentation and hand it out to folks. Now nobody does that. Nobody. It's like, if I'm going to share it, I'll share. I'll either send it to you or I'll send you a link, right? And nobody wants the paper.
Yeah, exactly.
So it's kind of fun. So back to training. Okay, so we've got those guys, and you were saying that one of the biggest challenges was getting people to engage, especially if it wasn't required, because it's a different way of doing it. It's just a new approach to doing things, and so that's a challenge. What techniques have you tried to? I mean, do to get people to engage in a different way? I bet it's a better place because they're engaging in a certain way, and you want them to engage in a different way. What has been a good technique there to help make that happen?
Well, honestly, I'm still struggling a little bit with that. So I haven't cracked that nut yet. I'm working a little bit more closely with the marketing department these days.
Okay.
I think my dynamic in the company is basically I'm working in the service department.
Right.
And so as a result of this, almost all of my activities are based in this area.
Right.
But as I want to expand this project a little bit more, we have to do a lot of different aspects in the company to support this, and this has to do with the corporate look and feel for the the courses themselves, the graphics need to be commonly used throughout different presentations and so on. So with this, I'm starting to work more with the marketing and graphics design team. And I'm pleased that they are open to working with me, and looks like they're happy to do this. And when we get to the point where we have, let's say, more streamlined the course look, I guess you could say, or the branding. Branding is the word I'm looking for. When we've more streamlined and synchronized this, then I guess the one idea that I have is to do a general posting on LinkedIn to see, we have a lot of our users are on LinkedIn, so drive up some interest in that way. And also, if we can put a requirement in place so that's enforced, that, okay, we want to train the doctor on a cataract procedure. Please take this cataract materials before we arrive. I've worked in other companies where they had reasonable amount of success doing this, where someone will look at the assigned courses and say, hey, doctor, I'm happy you took the courses because now we can finalize our travel arrangements. Or the other side can be, doctor, we would really like to make the travel arrangements, but
we're not going to do that until you take the prerequisite e-learning.
Yes, exactly.
Oh, interesting. On the LinkedIn thing, we've recently started posting a bunch of shorts on there, and it's amazing how many views they get. Yeah, to your point about pushing things to LinkedIn, I'd recommend that, and it's a good way of starting to get people to cultivate them to change. And we've been posting short videos, and I think it helps get the message out from a market, because we all have to market to a certain degree, right? You're trying to get people to change behavior. I think your relationship with marketing is a good idea. I think there'll be some, because at the end of the day, that's a marketing exercise to get them to voluntarily change.
Involvement with the marketing department with this. Yeah.
So I think they got a good handle on the understanding of the program as it stands today. There's a lot going on in the industry. AI is all over the place for every industry. Where do you see the program going in the future? If you could design the program that you wanted to design, where would you take this? Where do you want to be in the future?
Yeah, I'm looking at this at the moment more from the content development standpoint. And as you said, there's a lot of stuff going on these days with AI. One thing which has me a little bit excited now, and I'm hoping to get buy-off from the corporate standpoint, is that at the moment, the courses that I develop are a combination of didactic and theoretical and hands-on or interactive. Yeah. So I have, at the moment, basically a static avatar who's speaking through speech bubbles, but in fact, it's just text-to-speech that I've put in there. Text-to-speech has come a long ways.
Oh, yeah.
But I'd like to make this more personal, So the idea is that there are some, I think they're marketed as virtual, that's what I'm looking for.
Like the avatars?
Yeah. Virtual spokesperson, I think.
Okay.
We're talking about. So I'm trying to see if I could have the didactic portion instead of having the static avatar with the speech bubble, to have more of a live avatar, let's say, speaking, and it would be more like the YouTube videos that you see everywhere. Yeah.
Yeah. Have you looked into any tools to help on the creation on that side yet?
What do you mean?
No, tools to author that, to create those dynamic spokespeople.
Yeah, I've looked into a site called HeyGen, HEYGEN, and that looks like it could be quite useful. It also has an advantage that you can record yourself or anyone from your company. So you can use one of you working for the company, or you can use one of their standard actors that they have as well.
Interesting.
Yeah, and it will also take you put in the text that you want, and it has the option for translating in, I think there's a ridiculous amount of languages, like 70 languages it can translate into.
And you said it was HeyGen, HEYGEN? Was that?
Yeah.
Okay. Yeah, it was interesting because, one of the things one of the tools we've started using is Synthesia, which does a similar type thing, right? It has you can pick from their avatars, and then it's all text to speech type of thing. And one of the benefits of that we've seen, and that I'm starting to hear other people mention, is okay, it helps you produce the videos, and that's nice, and you can do it a little bit more efficiently than doing a recording of a person. But where the real benefit comes from, I was talking to somebody, and they said the real benefit is when you have to do updates, especially if you're in a high compliance environment, because as the products change, as the compliance requirements change, you don't have to reshoot the video. You just have to go into the part of the video where the compliance had changed, and update it. So and we started seeing that with our own product as we started producing explainer videos, and then we do an update to that screen, let's say, and then we don't have to reshoot the whole thing. It's just you put a snippet in that says, oh, there's now this other field and you could do this, right? So it's interesting. I think it's really interesting.
Yeah, with this tool, HeyGen, or the one you said was called
Synthesia. So I'm gonna check out HeyGen. I like that idea of taking
yeah.
yourself. I don't know if Synthesia can do the translations. I haven't looked into that.
So this is one thing that would take care of the didactic portion or the theoretical portion of my course.
Yeah.
But there's been some really good changes with Storyline. I use Articulate Storyline for content development as well. And they have some cool AI tools built into their software right now. Where, give you an example of a recent course that I did. Our bigger markets are English speaking, German. We have a big market in China, Spanish speaking, and French. So I've developed a few courses in 5 languages. And, it's really quite a challenge to do that because I have to develop it first in English. And I have to write the script line, sent the entire text of the script has to be written in a Word document someplace. And
right.
then I would normally put this through Google Translate or DeepL Translator as a first go. And then I would send it to various colleagues for them to make the corrections. And then to integrate this into Storyline, I have to develop the English course. Everyone agrees it's correct. And then you can have an automated translation for individual courses as it was, prior to the AI integration. So then I would have to make 5 separate courses and then integrate them together. And the time to do this was months to do these courses.
Right.
It was a ton of work, not only for me, but for my colleagues who I was lucky had the time to help me. But now with Storyline, there is an automated translation feature. So you put your course in one part of the menu, it's just like translate, and you can choose how many languages you want it to be translated into. So it's not just one, it can be 3 or 4, whatever. I think Storyline has now not so many like HeyGen, but I think it has, like 11 languages that you can make the automated translation. So this would cut my course development time down from months to weeks,
Wow. I mean, that's huge. That's a huge increase in productivity. So it beyond the using AI for content generation, is there anything else in terms of the future of your where you see the program going, where you want to take it?
In terms of the usage of the device, I would really like to have more of a integrated approach to education in our organization. So,
and what does that mean, integrated approach? I mean, it means something to me, but I don't know if that's the same connotation as you're using the word.
Yeah, so I'll take an example of a recent course that was a classroom course that was offered. Last year was offered a couple of times as a trial basis, I believe, to see if we could generate some interest. But Clinical and Medical Affairs hosted some courses on refractive surgery. That means LASIK. That means you could consider cataract in some cases, refractive procedure. There's a new procedure based on lenticle extraction where, LASIK will reshape the cornea of a person based on their eyeglass prescription. The lenticle based is essentially cutting a shape out of the cornea and removing that to free people from the need of eyeglasses.
Okay.
So there's a lot of stuff that are associated with these refractive surgery, including diagnostic devices, surgical techniques, and so on. And clinical and medical affairs had a classroom course that they developed, but they're managing it on their own. It's not part of the e-learning. It's marketed in a different way. It's handled in a different way. And I'm like, well, this is part of the learning strategy of the company. So shouldn't it also be part of the e-learning approach as well? We can monitor how everything's who has been there, um, when they left for the course, and so on. So when I say integrated approach, that means are all the departments leveraging the e-learning site in the best way possible, so that we are not creating more work for managers. For example, QA has to train everybody new on the company on QA procedures. That's taking the manager's time away from other stuff that they can be doing. So offload this to the e-learning, and that's when I say integration. That's basically what I.
So that's a pretty comprehensive training program, and it looks like a interesting future in terms of integrating it into the organization as a whole and continuing to evolve it for the medical providers and the distributors and service technicians. Shifting gears a little, one of the things I like to ask folks is when you're not working, what do you like to learn about? I usually find most of the folks in learning and development, we're big believers in education and acquiring knowledge, and so we usually have things that we like to learn about outside of work. As fascinating as work is, but outside of work, what's your favorite thing to learn about?
Well, in fact, some people would say that work is my life in some aspects. I do it because I love doing it.
Right.
I love what I do. And so when I'm not working, actually, in fact, some of my time is spent actually learning how to use the tools more effectively that I'm already using. So there's a lot of resources on Storyline that you can use to more effectively develop courses and use the features of the software. Also, the same with Camtasia. I make small videos with Camtasia for didactic parts of my e-learning, and it's a really cool program. You can do a lot with Camtasia.
Well, it's funny when you said that. You reminded me of one of my father-in-law's favorite phrases, which was, find a job you love, and you'll never work a day in your life.
That's right. Yeah.
Myself personally, I'm a technologist at heart, but more on the user side than on the developer side, even though I was a programmer back in my ancient history. So I just love playing with tools.
Okay.
And and seeing what you can do with them, because they're constantly changing. And I haven't been in Camtasia. I've used. I thought I like that. I haven't used it in a while. So you like Camtasia?
Yeah, it's very flexible. You can do a lot with it. Yeah.
I'll have to put that back on, because I like making videos. Need to make one for my kids.
As a matter of fact, I like everybody else, I browse YouTube and just keeping up on current events, or maybe learning how to use the software tools that I enjoy using. And I can look at how the courses are, or how these videos are put together, and I can tell pretty much the ones that were done with Camtasia.
If I recall, it was a very easy to use and powerful tool, which is hard to it's hard to hit that thread. Like I use the Adobe product Premiere Pro,
Mm-hmm.
and I think it's very powerful, but it's also very difficult to use.
Yeah,
Yeah.
I tried a few times the Adobe products, and my general impression is you can do everything that you want to do with it. I'm not
Right.
taking nothing bad to say about it from that standpoint, but I also think in many cases it's more complicated than it needs to be.
That's why, like with that, and with Photoshop, I find I can, to your point, I can do anything I want with this, but because I can do anything, everything is non-intuitive.
Yeah, I agree with that 100%.
Whereas when I use another tool, like I use Snagit, I use the Snagit editor to edit a lot of photos, because it's just, I can't do everything, but it's really easy to edit photos, right? And I was using Camtasia in the past, and I haven't. So
Actually, my most used tools are Snagit, Snagit Editor, Camtasia, and Storyline.
Yeah. Yeah, cool. Yeah. All right. Well, Bill, thank you so much. Well, first of all, thank you for your ongoing support as a client. We greatly appreciate it. I greatly appreciate it. But thank you for agreeing to join me on this podcast and share your training program with everyone. I think we learned a lot. I love these because I always learn something. And so I appreciate you educating me and teaching me some things. And that's great. And I just really appreciate your time. Thank you for taking time out of your day to talk to us and share your story with us.
Okay, and thanks for your invitation. Quite flattered to receive it, and it's been my pleasure to share a few moments with you.
And all the viewers out there and listeners, thank you so much for your ongoing viewing and listening. And we'll see you later. Take care.